Okay, so a pleasant morning to our students from our NCM 106 and 107. So this is our first session for your 106, 107 related learning experience, which is the sector on Frontliner in Focus, session 1. So we would like to welcome our NCM 106 and 107 students and also our faculty members who are here with us, your clinical instructors from 106 and 107. Okay, can you show your videos, guys? Our faculty members. Okay, so thank you very much. So this is a joint session for NCM 106 related learning experience. And later this afternoon, it will be posted at the YouTube channel Dignified. Okay, so during our orientation program, we specified that your intensive nursing practicum and RLE for 106 and 107 will involve several activities virtually or online. So it will involve case analysis, concept map as course task, case study, wherein you're going to critically analyze case scenario, offline activities, wherein you're going to monitor your family members or any significant others with you in replacement to the clinical duties. And the most exciting would be what we are having today, and that is what you call the frontliner in focus, nurses in the frontline. So we're going to learn from experts. Most of them are alumni of the Our Lady of Fatima University. They were students like you several years ago, and now they are working in the front line, not only in the Philippines, but of course in other countries as well. And as we go along with their stories of success, stories of challenges. So they will be also discussing very important topics that you must remember, especially considering the line of clinical work. So for this first session of our Frontliner in Focus, so we have a very special guest who is a frontliner, and he is not actually based in the Philippines, but based, of course, in the United States of America. So without further ado, please help me in welcoming the Secretary Treasurer of the Sigma Theta Tau International Honor Society in Nursing, Phi Gamma chapter, and a proud alumni of the Our Lady of Fatima University. So he received the most outstanding alumni award several years ago from the College of Nursing. So without further ado, let us welcome Associate Research Professor Dr. Irvin L. Ong from the OLFU BSN batch of 2008. Dr. Ong, say hi to our students. Okay, you can share your screen now and you can unmute your microphone. So we would like to ask our clinical instructors to please turn off their videos as we highlight Dr. Ong's feed from the United States. You can
So
share your
thank you.
screen now, Dr. Ong.
I can do that now. Okay. Let's go with this. And first and foremost, thank you so much for the very warm welcome, and also for the faculty and the leaders of the College of Nursing. Thank you for inviting me here. And for my future nurses, so please, I need your participation and your support throughout this session. Later on, I'll be asking some polls. So if polls appears in front of your screen, please kindly answer them right away because I don't want to waste anyone's time. So let's do this as smooth as possible. And if you have questions, you could write it down in the chat box, or you could simply do it later during our Q&A session. So with no further ado, so again, I'll be the facilitator for this session for the Nursing Intensive Practicum. So I'll be sharing about my life journey as a nurse. So um, our learning outcomes for this session is just simply to appreciate the professional life of a nurse through scholarship, servantship, and leadership. So um, hold on for a second. Let me just stop sharing. Okay, I forgot to share the sound. So our focus for today would be scholarship, servantship, and leadership. Scholarship can be in terms of your learning, your education, and research. Servantship, it's about your service either in the hospital or in the community setting. And leadership is how you provide or give influence to other people in their health, how to improve their health. So let's go with the first one. I'll be sharing my timeline with you. So these are just bits and pieces of my accomplishment in my life, professional life as a nurse. But before anything else, let me thank Our Lady of Fatima University. That's my humble beginning. I was a full scholar and I earned my bachelor's degree in biology in 2006. And I enrolled in BS biology because I was planning to become a doctor. But my parents, who migrated in the United States, they suggested that instead of becoming a doctor, why not try nursing? So of course, Filipino values, opo, sige, try natin. So I tried BSN, and in 2008, I was able to receive my license as a nurse. And then from then on, the next challenge was my family are in the United States and they're expecting me to become a nurse in the United States. So following the the timeline, so I went to New York and took the exam, and I was able to successfully earn the license, the New York license. And because of the immigration issues and challenges during those times, I decided to start my career in the Philippines instead of to wait further and delay becoming a nurse professional. So here, I started as a nurse reviewer and also as a nursing consultant at STI Academic Center. And because of my accomplishment there, my performance was good. So I also engaged in continuing professional development. So in 2011, I earned the degree in Masters in Health Professions Education from the University of Santo Tomas. And I was also hired by St. Luke's Medical Center at Quezon City to become the technical and professional training specialist. So I provide trainings, I design and provide trainings for both clinician and non-clinicians. And now from this timeline, from this portion, please remember that I have two issues. The first one is in terms of licensure, and the other one is about my nursing career. Moving forward, because of my passion for teaching, I institutionalized the American Heart Association International Training Center at St. Luke's Medical Center, and I became the first training center coordinator. And also because of these achievements, Dr. Dino tapped my expertise for the research center. And since 2012, I became the external research specialist of Our Lady of Fatima University. And until now, I'm still doing consultancy work for Our Lady of Fatima University. That is a way for me to give back to the university. Now, since I'm already capable of doing my nursing role as a nurse educator, I'm very good in doing that. But something is missing, and that is in terms of advocacy. Now, as a nurse, you need to give back to the society. As a nurse, you have to care for others, not just in terms of your workplace, but you need to expand your horizon. That's why I decided to engage in Sigma Theta Tau International, or this is the International Honor Society of Nursing. And I became a chapter leader of the Phi Gamma, or this is the virtual chapter of Sigma Theta Tau. And this is for the international part. For the local part, I went and engaged with the Philippine Society for Quality and Healthcare, and they recognized my outstanding contribution, and they bestowed to me the fellowship member. And I also became a board member of the Philippine Society for Quality and Healthcare. And because of this achievements and accomplishments, um, Our Lady of Fatima University awarded me the most outstanding alumnus in 2013, and also St. Luke's Medical Center awarded me the Associate of the Year award for managerial support. And in preparation for the K to 12, I decided to go to take the licensure examination for teachers because of my education background from Our Lady of Fatima University. And surprisingly, I didn't expect that I'll grab the top 7 spot during the licensure examination for teachers. Like I said, this is just preparation for the senior high school, because for you to be able to teach health courses in the senior high school, you need to have at least a license for teaching. So this is a preparation. And then, like I said, it is important for a nurse to go beyond the horizon and extend their hand to other institution, organization, and other stakeholders. That's why I invested in joining Kappa Delta Pi. So this is another international honor society, but this time is in education. Now, I had encountered 2 additional issues here. The first one is in terms of continuing professional development or simply learning. And then the other one would be advocacy. Advocacy is really important, especially as part of your resumes. So whenever possible, you need to start early and think about the advocacy you want to share to the world. And then here comes 2016. This is very crucial time for me. Like I said, my career, a nursing career was prospering then in terms of nursing education. But here comes my immigration papers, and my immigration lawyer advised me that it's time for me to go to the United States. So I was expecting that in 2008, and after like almost 10 years, they just told me that, oh, 2016 is now a good time for you to go to the United States. And I was really caught in between whether to continue or not. So it was a very tough decision, but I decided to move forward. And I said, like, before I go to the United States, let me give back to my community. That's why I applied for lifetime membership for the Philippine Nurses Association, just to make sure that I'm still affiliated with my hometown, the Philippines. And another problem, like I said, I went back to square zero or square one. That's why for licensure, I went to Illinois. Now I need to get again a license, which I did already before for the New York and for the Philippines. So this is a tough one. It's just like repeating the cycle of my nursing career and the challenges that I encountered before. So luckily, I got my nurse license in Illinois, and I am now a full-time nurse and a part-time supervisor in a skilled nursing facility or a nursing home. Some of us have a very little understanding of nursing home. We're thinking about in the Philippines, when you say nursing home, it's just similar to elderly care or home for the aged. But I tell you this, it's really different setting, and the nursing home in the United States is just like a hospital in the Philippines. So I'll tell you more about that later. And now this is also a crucial time for me. Like I'm also finalizing my doctoral studies in the Philippines while I'm in the United States, because the only thing that I lacked before it was my doctoral dissertation. So while adjusting as a floor nurse, I'm also doing my doctoral dissertation, and with all the sacrifices and hardship and support from family, loved one, and friends, I'm very happy that in 2018 I earned my Doctor of Education degree from the University of Santo Tomas. And because I cannot do a full-time research like I'm doing before when I was back in the Philippines, I engaged myself in doing peer reviews. So I became a journal reviewer of different journals. And for 2020, this is the year of the nurse, and this is the year of COVID, the pandemic. This is a very painful and challenging year for all of us. But I'm looking at the silver lining and the good side of 2020, where I became I'm now the current secretary treasurer of the Sigma Theta Tau International, the virtual chapter. And also I was accepted for graduate admission at Johns Hopkins School of Nursing for the Doctor of Nursing practice. And let me take this opportunity to also congratulate Dr. Dino, because he was accepted for the PhD in nursing program. This is something to be proud of, because in America, to be accepted in prestigious school like Johns Hopkins is really a prestige for for applicants and incoming students. So moving forward, I'm identifying three more additional issues that will be for transition, research, and caring. Now, as a reviewer, after I earned my BSN degree, the common question would be, how can I be successful with my licensure? When I was a reviewer, many students were approaching me, asking me, do you have this a recipe for successful licensure? There's no specific recipe that I can give you, but I can only give you strategies and hints. The first ingredients for successful licensure is a cup of knowledge. You need knowledge, nursing knowledge from your BSN program. Be confident enough that you have the quality brand of all food education, nursing education. That means to say that within that 4 years time, you already received the best and quality nursing education, not just in the Philippines, but worldwide. So be confident that you have that knowledge, but not too overconfident, because like I said, you need to take all the reviews, advices from your coordinators and from your mentors at Our Lady of Fatima University. The second one is we need a spoonful of test-taking strategies. Take note that knowing something is different from answering a question. So many of us knows a lot in terms of nursing, but in answering questions, it's like something else. That's why you need to do practice your test taking skills. You need to do more test taking strategies. Make sure to answer the board questions, regardless whether that's for local board or the NCLEX exam or any foreign nurse licensure examination. Lastly, is we need a good amount of confidence. Anxiety is the number one enemy of any test taker. So we need to build up your confidence. So for this session, we have a poll. So what is your goal? Whenever whenever someone is asks you about what is your goal, you have to answer them in a loud voice that your goal is to top the board exam. So I repeat, what is your goal? Please answer the poll now.
To top the board.
Okay, so our goal is always to top the board exam. Why to top the board exam? Remember, we are all Fatimanians, we are all full nurses. That's why we rise to the top. For the next issue is in terms of nursing career or pathways. Magtatagalog lang ako Talagang may nagsagot doon sa ika-apat to top the board exam 2%. That's fine. So let me help you finding your career. Now, many of us, we're already at the terminal end of the nursing program, and we don't know yet what we want to be after graduation. Now, let me help you by giving you two ways of determining what you want to be as a nurse. The first one is to think of the place that you want to, the workplace that you want to be in. Like if your workplace is like you're fascinated with the hospital, then you become a hospital nurse. If you want to be in the companies like clinics, then you become a clinic nurse. If you want to be in airlines or airports, then you could be a flight nurse. But if you wanted to be more closer to the public, to the people, then you could be a community nurse. But let's say this first strategy doesn't work for you. Then the next option would be to think about the role that best suits you, that best describes you. So if you're into teaching like me, and also with our NCM faculty, then you could be a nurse educator. But if you wanted to be more of like in a hospital, more of a clinical side, then you could be a nurse clinician. Or if you're into technology, like informatics, then you could be a nurse informaticist. So you need to think of the place you want to work and the role you want to be in. So by using these two strategies, this would help you out in identifying the best career pathway for you. And as early as now, I invite my fellow future colleagues and nurses to invest on LinkedIn. So as early as now, establish your LinkedIn account. Make sure it's professional, not just Facebook. Make sure it's LinkedIn account. Now, based on the second issue, let me ask you, please, for the poll. Can you bring up the poll, please? Now, for the second issue, my role is to be, please select one from the poll. I hope by using that kind of exercise, you'll be able to focus more in identifying the right career for you. Moving forward, this is just a snapshot of the Philippine Qualification Framework. Oh, okay. For the role, many want to be nurse clinicians. So congratulations, everyone. So I'm very proud of you, even if it's the year of COVID. You're not afraid to work on the floor. So thank you so much for your service as early as now. Now, like I said, this is a snapshot of the qualification framework of the Philippines. So at this point, you're already at level 6 or the BSN program. After this one, your next option would be to take your master's degree and your doctoral degree. Now, just to share, in the United States, you have many options, not just simply have your MAN or your MSN, but they also have your dual master's degree program that you could combine with master's in business program and other certificate programs. And in terms of their doctoral programs, they have a doctor in philosophy, doctor of nursing science, doctor of nursing practice, doctor of education, and other dual programs as well. Now, by looking at this, I want you to answer the next poll in terms of what is your dream, what you want to be in the future. Because I advise you as now, a BSN program is not enough to build up your qualification. So please take a look at all the options and select one. So I'll be going to issue number 4 while waiting for the poll. Now, in terms of advocacy, let's reflect on the Sustainable Development Goals of the United Nations. So here you could see there's many areas. There are 17 goals that you could choose from. Now, the result of the poll for issue number 3 about continuing professional development, majority wants to be in the Master of Arts in Nursing or MA in Nursing. Now, just to mind you, remember I asked you in the second issue what you want to be, and most of you answered to be in the clinical field. But now your master's degree is in Master of Arts in Nursing, which means to say this is more of the teaching side, while the Master of Science, it's more of the clinical side. So remember, if you want to be in the clinical aspect of nursing, make sure to go with Masters of Science in Nursing. But since in the Philippines, there's limited offerings in terms of master's degree, as long as your Masters of Science is related to your field, like let's say med surg or pediatrics or psychiatry, then you could go for it. Now, moving back with the Sustainable Development Goals, now for me as a nurse, I want to contribute on the, as a nurse, wanted to contribute on the good health and well-being of the human race, and also the quality education, because like I said, I'm really inclined into education. That's why as a result of this, like I said, I engage in the Sigma Theta Tau International for SDG goal number 3, and for Kappa Delta Pi for SGD goal number 4. Now, for the next one is, how can you help? Identify the sustainable development goals you want to contribute in. So please kindly put up the poll, please. Next is I'll be facilitating my issue about transition. Now, like I said, this is very crucial for me, like whether I was torn staying in the Philippines or moving to the United States. So remember, for the nursing advocacy, even if we are nurses, let me just go back. Even if we are nurses, we could always contribute, not just in goal number 3 and number 4. Remember, as nurses, we could also advocate for gender equality. And let's say you are a nurse in a remote area or in a displaced area like in Mindanao, some with wars. in Mindanao, then you could always advocate for peace, justice, and strong institution. Also, if you're into like protecting not just people but also the planet, you could also go with goal number 13, 14, and 15. So you should not be limited with goal number 3 and number 4. So in terms of transition, the hardest part migrating to the United States, the first one is in terms of language. Now, most of us are thinking like, oh, it's okay that America is a good place because they're using English, they're English-speaking country. But mind you, my future nurses, that in the United States, it's like a melting pot of all races and culture. That means to say that they have more than one language, more than one language. And for the language that's commonly used, it's English, but many of them are into Spanish. And in terms of speaking Spanish, there are many types of Spanish, Spanish speaking people here in the United States. Some of them are Mexicans, some of them are Puerto Ricans, some of them are real from Spain, and and there are also languages like Filipino, um, Nihongo, all Asian language from India. There's so many, also Arabic. So there's a plethora of language. That's why this is a barrier. When I started here, the English of African American, they have a very thick and heavy accent that is really hard to understand. And there are also Australian, Canadian accent that you need to be acquainted with or to familiarize yourself. And language is the number one barrier, especially if you're transitioning to another country. The second one is in terms of culture. As you could hear in the news in the Philippines, there are issues about racism and other issues in terms of the politics and stuff like that. So you need to be aware. And the the advice that I could give you is you need to bring out your Filipino values of being kind and respectful. If you're kind and respectful towards other people, especially here in America, they will respect you as well. And lastly is in terms of practice. Although we're using books from the United States, like because our education system is really patterned with the nursing program, but still our practice, nursing practice, is really different from here in the United States. Number one is like in terms of medication administration in the Philippines, we usually do the medication administration record or the MAR, and we do it manually, especially in remote areas. Although some hospitals, especially those leading hospitals in the Philippines like MHPEd, also I think Fatima University is also investing with nursing informatics, but still here, just like in nursing home that I'm working with, we're already using healthcare system like programs in terms of medication administration. So here in America, we do it electronically, while in the Philippines, we do it manually. So it's really different. The way you give or administer medication using paper and pen or the traditional chart is different from using a computer. Now, the strategy that I could share with you is to bring out the good side of being a Filipino nurse, being an awful nurse, and awful nurses or Filipino nurses rather have a good bedside manner. Now, in terms of good bedside manner, you could see in the two comic strips. Now, here is that if you don't have good bedside manner, that means to say that you're you're allowing your patient to be, or resident or client, to have a poor quality nursing service. So good bedside manners allows us to bring up the quality of care and to make sure there is patient safety. And how can you do it is to have your heart, head, hands. So heart, it's making sure that you empathize with your patient, be more understanding, be more caring about your patient. In terms of head, that means to say you need to have the knowledge, the nursing knowledge, and the hands, the competency to do it. At times, there are nurses, they know it, but they don't know how to do it. Let's say doing urinary catheterization, inserting a Foley, you know how to insert a Foley, but you don't know how to do it. So as a nurse, you need to know, and you know how to do it as well at the same time. But knowing the procedure and knowing how to do it doesn't qualify as a good bedside manner. You need to have the component of the heart. So before you do any nursing procedure, you need to get in touch with your patient, understand them, ask for their consent, introduce yourself. In other words, build up that kind of relationship that is expected for the nurse patient relationship. Now, please kindly bring up the poll. S- So, which statement is a good bedside, demonstrate a good bedside manner? For issue number 6, in terms of research, we really, nurses needs to invest or do research, not just doing research, but simply just engage in different research activities. Okay, perfect. We got 100% good bedside manner. So you could always say, hi, I'm Irvin. Good morning. How are you? Or musta na? Ano nangyayari sa inyo, nay? So you could always do those kind of introduction. Make sure the respect is there, the understanding is there, empathy is there. Now, for research in the United States, there is the National Institute of Health. This is the largest, the nation's largest medical research agency with 27 institutes. And surprisingly, with the 27 institutes and centers, one of which is the nursing research. That's why they're prioritizing nursing research as part of the core component of medical or healthcare research. Now, as a student nurse and also as a future nursing professional, once you step into the world of being a floor nurse, it will be very hard for you to engage in research activities. In the hospitals, especially in the Philippines, what they're doing is they're engaging in what we call a project improvement uh, performance improvement project, or they also have the project improvement team. So they're part of that kind of team, so that it will be a collaboration between the doctors and medical professionals, so that they could do a research in improving their services. Now here, let me share with you a simple way for you to be engaged in research activities. We call this the murals. What are the murals? The first is you could make researches if you have the time. Like in your thesis or nursing research, you could do your papers. The next one is you could use findings from scholarly articles in your work, integrate it, then that's part of it. Or you could also use it in your daily lives. Like let's say you find a topic in terms of good health or health promotion, health exercise, and you use that findings to improve yourself, then that's also part of doing research activities. The third one is to read. You could read articles, you could read books or anything that is like that would help you be abreast with the current situation. Next one is to appreciate. If you don't want to read, appreciate the titles that you see, the new findings about COVID. So that's a good way of doing it. Another thing is to look for information. Let's say you have an assignment, try to look or use databases for your assignments and projects. Especially now we're doing online learning. So you could do like Google Scholar, you could also do PubMed to look for information. And lastly is to share your information, share your experience, positive experiences about research activities. So
There's
please
22 hours.
please kindly put up the poll. So for research activities, what do you want to do? So kindly select one from the murals, and I'll go ahead with issue number 7. Now, like I said, I'm working in a nursing home, or it's commonly called here as skilled nursing. So what is skilled nursing? So it is a facility for people needing constant healthcare with issues in ADLs. So this is the nursing home is also known as the skilled nursing facility, or SNF. Now, for SNF, we provide care for different kind of condition. We have post-acute, acute, subacute, long-term palliative care, hospice care. For the post-acute, usually these are the ortho cases or med-surg cases from the hospital. That means to say they are already stable enough to be discharged from the hospital, but they are not safe yet to be discharged home. So the nursing home becomes a transition. This is similar in the Philippines, the med-surg or the medical surgical ward that we have in the Philippines. So this is what we call the post-acute care. Now the acute care is, let's say they're already a resident of the facility and they develop diseases or illnesses, then it becomes an acute condition. In the nursing home, we try our best to resolve the acute cases, but if it becomes life-threatening, that's the only time that we send out the patient back to the hospital. In the nursing home, we also handle dialysis patient. Take note that dialysis patients are not stable patients. They are clients with constant needs because of the dialysis. That's why in the nursing home, we also have dialysis patients. Now, for the long-term care, we also have a dementia unit, like for those with psych issues. And we also have the end-of-life issues, just like for hospice and palliative care. So other people think like nursing home is as simple as like taking care of your loved ones at home. No, nursing home or skilled nursing facility is really challenging, and I have encountered many nurses who work in the hospital who cannot thrive or work in a nursing home setting. They usually quit after a week because of the challenges in a nursing home. For the procedure, we do medication administration, wound care management, infection prevention, and client care management. Now, the primary function of the nurse in the nursing home would be medication administration. We administer medication, and I tell you, the nursing home has tons of medication. So at times it's a cup full of medication just for a single patient, and they have all the expensive medication that you cannot even find in the Philippines. For the client care management, we do all the procedures just like for the life vest, for the cardiac support. We also do G-tube. We also do suprapubic catheter, like in terms of the care, but not the insertion. We also have a tracheostomy patient or the trach patient. Like I said earlier, dialysis patient. So all the procedure for the fistula, like if there's bleeding, you need to manage that. If the Foley is not working, you need to change and replace the Foley. If you need to do suctioning, you need to do the suction. In terms of the ventricular assistive device or the VAD, we also manage VAD patients. So you need to do to check all the controllers and stuff like that. And in terms of staff, you'll be surprised that the nursing home is not just for nurses. It's a place for physician assistant, the hemodialysis team. We also have the dietitian. We have the physical therapy, occupational therapy, speech therapy, respiratory therapy. And let's focus at the middle. You could see the NP. The leader or our liaison to the doctors or the physician will be the nurse practitioner. So the nurse practitioner, they are acting like the doctor on behalf of the doctor, so they could prescribe, diagnose, assess patients. And the next would be the nurse. So in a nursing home, we are the leader in that healthcare facility. We take charge for the licensed practical nurses and the CNA or certified nursing assistant. Usually, we work with the nursing assistant in providing the activities of daily living. Let's say emptying the bedpan, offering the bedpan. So that is the job of the nursing assistant. In terms of feeding, all the dailies of activity living, support of that, that would be for the nursing assistant. For the LPNs, there's not much difference with the licensed professional nursing and the registered nurse, except for the IVs and assessment. The LPNs cannot do their assessment, but they could always give us their observation. They cannot do IV insertion, only the RN does. So those are the nursing staff at the middle. So we have the nurse practitioner, the registered nurse, the licensed professional or vocational nurse, and the certified nursing assistant. Now, let me share with you the history of pandemic. Because a hard hit facility would be the nursing homes here in the United States, and also the part of all the rest of part of the world. So for the pandemic, this is not new. The humanity has experienced a pandemic, but the issue right now is people, the healthcare provider, have forgotten how to respond and react to pandemics. Now, even before, we already have the bubonic plague, and also we have the cholera, the flu, the SARS, the MERS, the Ebola, and now the COVID. So everything is not really new. But like I said, because of the advancement in technology and in medicine, and also with the treatment of symptoms and management of diseases and infection, people became too complacent, and some of them became non-believers of science. Now, here are just the comparison of the death toll of the bubonic plague from before, and also the Spanish flu and the smallpox. This is the time when there was no vaccine yet. But would you imagine if COVID happened before with no vaccine, no antibiotic, no antivirals, no steroid treatment? So things would have been different. Now, take a look at coronavirus and the HIV virus. So this is just a representation of the size, how small the COVID virus is. That's why it's really hard to fight against, even if we do all the hand washing, wearing of the PPEs. It's really hard for us to protect ourselves because it's really, really small. Like I said, the outbreaks or pandemic or infection is not new. It happened before, and we're very familiar with malaria, tuberculosis, the flu, smallpox. All of this are we're really familiar with. But the difference right now is we don't have the vaccine yet, and we don't have the specific antiviral for the treatment of COVID. Now, let me share with you what happened in the nursing home that I'm working with. So here's the very contagious unknown COVID. Because it's so small and highly contagious, it went to the nursing home. And like I said, in the nursing home, we have post-op patient, we have all the vulnerable groups, like the elderly, those with chronic diseases, those who are uh, having end-of-life issues, those who went surgeries. So they're highly vulnerable. Because of this, we try to do infection prevention, not just control. It's infection prevention. We did our best to prevent it from happening, but it spreads so fast and it's very hard to deal with. As a result, infection spreads out throughout the facility, and no matter how much prevention we efforts we put in, it's really hard to stop. That's why now we put all our efforts in mitigating the infection. Now, I saw earlier during the poll that most of you wanted to work on the floor. Now, the difference in the hospital and in the nursing home that I'm working, in the nursing home, everybody is like aging. Everyone is like vulnerable. Unlike in the hospital, you know that whenever they enter the hospital, you know they are sick, they have some condition. So you could isolate them right away. But in a nursing home, with a census of more than 120 patients, it's very hard for you to isolate one from the other. And take note that they're in a nursing home because they need assistance with, with their activities of daily living. So how could you feed someone without approaching them? So you need a direct interaction. That's why the spread in the nursing home is so fast. And like I said, this is really tragic for all of us, not just in America, but the rest of the world. So for my dear future nurses, let me share with you this. At this point, you are still student nurses, and I don't expect you to be working yourself in a hospital. And at this point, just like for your related learning experience, you're doing it remotely. So I want you to wait. Take note, I want you to wait. Wait for your turn to shine and help us at the front lines. You means update yourself. Update yourself with the current information. You could do this by going to World Health Organization. You could also access the Department of Health. You could also go with the CDC. They provide up-to-date information about COVID. The W is about the gold standards that we must do during pandemic. That is to wash our hands, wear our PPEs, and widens our distance. Take note, these are our gold standards. Make sure to wash your hands more frequently, no matter how minor it is. Wash your hands. Wear your mask and face shield, and a full set of PPEs whenever you're working in a hospital or in a healthcare facility. And if they don't have these PPEs, make sure to avoid working or having a direct contact, because it's really hard to find healthcare workers, and if you get sick, then nobody will take care of your patient. So that was our issue in the nursing home, because I was tested positive, so automatically I cannot work in the nursing home for more than 14 days. And make sure to widen your distance, not just having a social distancing. Make sure to widen your distance. If that's 6 feet, if you could do it like 10 feet away, if you could do it remotely, if you could celebrate birthdays or parties virtually, then do it. Widen your distance. A is to assess your vital signs. Now, usually we abbreviate vital signs as VS, but now we have to assess not just the vitals, but also the symptoms. The common symptoms for COVID, you always need to ask them if you have cough or shortness of breath, because those two are the common symptoms. And then the hardest part, it broke my heart several times already, is the isolation, because these are elderly patients with psychosocial needs. That means to say they need family or their significant others or loved ones. They need the interaction with them. But because of COVID, we need to isolate these people from their loved ones. And you could see them getting in touch with them through the window. So the family members or friends are outside the facility by the window, and their loved ones are behind the window. It feels like they're in jail. And I tell you that earlier that some of the patients are demented. That means to say they don't even know how to use the phone. But we cannot stay there inside the room because we need to lessen our contact with the patient. So we cannot just stay there and assist them with the phone. So this is really tragic for us. And in terms of isolation, if the hospital or the healthcare setting doesn't have a dedicated COVID unit, they need to put a dedicated COVID unit to lessen the spread or to mitigate the spread of infection. And lastly, we need to do the testing, tracking, and the treatment of the COVID. So this is a public health strategy. So remember, we need to wait. You wait. So can you please pull up the poll, please? Sorry, wala na palang poll. So, as nurses, as future nurses and nurse leaders and nurse practitioners in the Philippines, I believe that all of us have talent. We have talent for caring. But that talent for caring is useless without helping other people. So, as nurses with the talent of caring and we help out other people, that means to say we become useful to the society. Our life has purpose, in other words. Now, for me, like I said, I was tested positive for COVID and the symptom doesn't go away. I was sick for almost a month and I was really afraid for my life. I thought that I won't recover anymore, but luckily the symptoms are not that severe. But you could tell that my fevers are up and down. I have this cough. My cough is getting worse, and at times I'm having shortness of breath. I cannot talk, and I cannot talk because I'm catching my breath, and I don't have sense of smell. I don't have sense of taste. I have GI issues. So everything, I was tested positive in, you could see here in April. And then while recovering at home, I decided to look up for the American Red Cross and I signed up for the convalescent plasma. And I received an invitation for Vitalant just to share. American Red Cross doesn't do bloodletting. They always refer to a third party or a clinic who will do it. So for my case, that would be Vitalent. And in my own way, I said that I want to help other people, not just in the nursing home. So I became a plasma donor because of this. Now, what is convalescent plasma? Like I said, you need the plasma of a COVID survivor, which the case for myself, that would be me. So we need this yellow stuff that contains the antibodies. So this is my picture when I did my donation, the convalescent plasma donation. So there's the machine. They do it with the machine, and it will take you like an hour to finish. So this is the plasma, like I'm saying. Now let me share with you. That's just an overview of a convalescent plasma. Now let me share with you a video from WGN News about convalescent plasma.
One of the greatest hopes for treatment right now is convalescent plasma. It's been around for 100 years, using the antibodies from someone who's recovered from an infectious disease to help another patient still inflicted with the same infection. But the promising therapy depends on donors, and right now they're in short supply. The bags are lined up, ready to fill. Supplies are at the ready, but when it comes to convalescent plasma donors, it's been a slow trickle.
Literally just in the last 2 days. I mean, literally just got started.
Hospitals are calling. Doctors and patients are waiting for the potentially life-saving antibody treatment.
We've been trying to do this for about a month with Chicago Medical Society, and we've seen every hurdle put in front of us.
Finally, the program is up and running at Vitalent Blood Service, a collaborative effort with Metro infectious disease consultants and the Chicago Medical Society, designed to boost the supply of convalescent plasma for COVID-19 patients in the Chicago.
Just to share, this is the full blood. This is the RBCs, and this is the plasma. So the full blood goes to the machine, and then it will separate it. So you'll have your the plasma and the other blood components, the RBC and the white blood or platelets. And here you have the saline, normal saline. This is just to help you out with the fluid because you're losing your plasma, the fluid part of your blood. That's why they're replenishing it with normal saline.
Chicagoland area.
Today we have 12 units available for our group, and right now we have somewhere probably 800 and 900 patients in the hospitals from our group with this, so we have lots of need right now. So please come out and donate.
Just like giving blood, the process starts with the squeeze of the hand. Fluid flows and the components are separated out. The red blood cells and platelets will go back to the donor. This yellow fluid is the plasma. That's where the antibodies live.
I've prescribed a dozen doses. I have yet to receive one. I think we have our first dose today after a wait of something like 10 days, which is way excessive. But with this program, hopefully when we order it, we'll be able to get it and we can help the patients sooner, because I suspect the place to give it is sooner rather than later for these patients.
Within an hour, collection is complete, and within 48 hours, the plasma will make its way to the bedside. A single donation can supply antibodies to 3 critically ill patients.
Here in the beginning, with so many patients and so few donors, every product we collect is going directly to a hospital, and it's going to be that way for a while until we catch up.
Okay, so that's about the convalescent plasma. And just to summarize the video, they're talking about the antibodies that is present in the yellow part of the blood from the plasma. So we need these antibodies to develop like what we call the passive immunity. So we're hoping that through convalescent plasma, we will trigger a passive form of immunity to fight against COVID. Now, this is the illustration that for this to work, we need the donor to donate his or her plasma, and we need to administer and infuse this to the COVID patient. And this is the machine, like I told you, that separates the blood, the plasma from the blood. And they call this the procedure apheresis. So the apheresis, that's the procedure that is being done to separate your plasma from the blood. And then I have some facts about convalescent plasma donation. So is the donation new? No, it's just like similar to your usual or traditional plasma donation. Is it painful? Yes, because they're gonna stick you with needles, but it will go away and you'll get used to it. Risk? Yes, because they're taking away your blood. At times there are machine errors, at times because your blood vessel is thin or something with that, you'll be more prone to bleeding. But like I said, these are the usual or expected reaction or complications for the donation. But like I said, this is like safer as compared with other procedure. How long is it done? Based from the video is 1 hour, but at times it's 1 to 2 hours depending on the situation, but usually on the average is 45 to 60 minutes. How much plasma is being collected? Now, there's no standard amount, but usually it's within the range of 500 to 880 ml, and it depends on the height, weight, and gender. Okay, so it depends on the height, weight, and gender. And how many times? Because of the need for the convalescent plasma, they're allowing every 7 days or at most 8 times in 3 months. But if this is the usual or the ordinary plasma donation, then they're allowing only 13 for a year. But like I said, because this is very urgent and very high demand, they're also saying that this is a golden fluid that is really expensive. That's why they're allowing this every 7 days. Now, for the convalescent plasma therapy or the serotherapy, is this new? No, it has been with us for more than 100 years. This is a strategy done with the previous pandemics. Is it proven yet for COVID? No, they're undergoing trials, and this is only for emergency use because everything at to this point, everything is assumptions. They have anecdotal evidence. That means to say that they administer to the patient, but it's not a clinical trial. So they cannot really isolate the effectiveness of the convalescent plasma. But they are using this since April. Are there risks? Yes. Like with any blood transfusion, because this is a blood product, so there would be a risk. Just remember, for blood transfusion or plasma transfusion or infusion, there's the ABC. A is allergy, B is breathing, like lung problem or issues, and C would be the complication like bleeding, infiltration. So those are your ABC for the risk. And for the time, how long it is being infused, it's 1 to 2 hours. For the dose, like I said, there's no standard dosing yet, but the administration is usually 200 ml per session. And at times, if the patient can tolerate it, they're gonna administer 2 more additional doses. That is amounting to 600 ml. And then what is our nursing consideration? That is close monitoring for the adverse reaction and also for other reaction the patient might show after the procedure. So for the session course tasks, it will be posted on the Canvas. So Dr. Dino will facilitate the course task. So I want you to earn a certificate of achievement after completing an online course on COVID-19 effective nursing in times of crisis. This online training is provided by Johns Hopkins University for free. So as my future colleagues in the field, I want you to experience the Hopkins way of online learning. So again, thank you so much. And sorry, I think I went beyond my time.
Um, Thank you very much, Dr. Irvin Ong, for sharing your expertise with us. And because we're very much sure that in the future, when they took the board examinations, so there will be a lot of questions regarding COVID-19, including the therapies that you actually discussed earlier.
Mhm.
So at this point, may we request our students to turn on their cameras as we call on Ma'am Sharon Kahayon if they have questions. So if you have questions, you can type in your questions at the chat box, or if you want to speak, you can speak and ask your questions. Ma'am Sharon?
Okay, good morning, and thank you very much, Honorable Dr. Irvin Ong, for having you as our first frontliner guest speaker for today. I want to thank you, Doctor, for sharing all your challenges here in the Philippines in your nursing journey in the United States. Thank you for sharing your compassion, your wisdom, and expertise about COVID-19. We will remember your weight, the update, wash hands, wear PPEs, assess vital sign, isolate COVID unit, and testing and tracking COVID. Okay, and also for sharing us your knowledge about convalescent plasma therapy. Now, student, we are now open for having your answering your questions. To start on, sino may question, guys? Guys, don't be shy. Pwede magtagalog kay Dr. Irvin.
Ako lang to. Ako lang to.
Guys, graduating student, keep
Yeah.
shining. Anybody? Pestaño Patrick, can you share question? You are the president of the graduating student, right? Mr. Patrick Pestaño?
Or maybe the faculty has some questions, or
Okay, anyone?
Dr.
Questions?
Okay, Dr. Ong, may I ask, how's the percentage of the effectiveness of convalescent plasma therapy with regards to the COVID patient in the United States?
percentage, it's I cannot give any percentage. Like I said, everything is under clinical trial, so everything is under investigation. So like I said, it's really hard to tell because we don't have enough data to support any claims. What I'm certain of is that we are in need of convalescent plasma as a supportive management while we're investigating about its effectiveness. To put it simply, is like there's no harm of giving it as long as it's compatible with the blood type. It's just like taking a vitamins to support the immune system of the person, and they're hoping that it will boost up the immune system for the passive immunity. So that's why the doctors, the physicians here, the emergency doctors, they are not really taking the risk, but they know that it's safe and the patient is being monitored closely. And before the patient will undergo such treatment, they have criterias that they need criteria to follow or to check whether the patient is eligible to undergo the therapy.
Thank you, Doc. How about the nurse who will facilitate the convalescent therapy? May different training bang dapat mag-undergo si nurse before she will be handling convalescent plasma therapy?
It's just the same, just like with your plasma product, like with your other blood products. Like depending on the facility, whether if your frozen plasma will be like at room temperature, if you're gonna use a warmer or not. So it's just the same thing. And at this point, like I said, hindi ko naman sinasabing you're on your own, but because the COVID situation is really still high, there's a spike up of cases. That's why nurses help each other to discover new possibility. I don't want to say trial and error, but at this point, because we don't know anything yet about COVID, that's why lumalabas siya na parang trial and error. But for the administration of the COVID plasma, like I said, we depend on the doctor's order, and it's just the regular plasma administration na ginagawa natin.
Thank you, Doc. Thank you, Doctor. Miss Shan Rezon, do you have question? Mr. Shan Rezon?
Good morning po. Tanong ko lang po dun sa uh, plasma therapy. Possible din po bang magkaroon ng like maging positive din yung recipient if ever?
So let me rephrase yung question. Yung question mo is, kapag naka-receive ng convalescent plasma, yung recipient ba is may tendency na magkaroon ng mag-develop siya ng sarili niyang antibodies coming from the plasma from the donor? Yun po ba yung question?
If po, for example, in terms of yung pag yung sa transmission po ng HIV, is it possible na magkaroon din po ng antibodies po?
Yes. Lahat ng complications like HIV, lahat ng blood-borne pathogens can be transmitted through the plasma donation. But it is less likely to happen, although it may happen, but it's less likely to happen because once they collected the blood or the plasma or the blood products, they will test it right away for all the screening tests before they could give it to the hospitals. That's why dun sa video kanina na nakita nyo, even sa Red Cross sa Philippines, ganun din yun. They screen the blood for HIV and everything, ini-screen out nila yon. So kapag merong nag-positive doon or what, then they will inform right away yung donor na ganito, ganyan yung blood.
Okay, Dr. Ong, thank you. Next, John Patrick Vicmudo. John Patrick.
Sir, curious lang po. At risk po ba yung nag-donate ng plasma na bumalik yung COVID? Since di ba po, antibodies po yung kinukuha sa patient?
Once nag-donate ka ng plasma, they're getting the plasma. But remember, it's just a portion of your plasma na nakukuha. And your body is still producing antibodies. That's why regardless kung mag-donate ka ng plasma o hindi, or kahit sobrang dami nang na-donate mo, yung antibodies mo will still be there because your body keeps on producing antibodies. And then, hindi mawawala yung antibodies na yun except kapag nawala mismo yung immunity mo. Let's say yung katawan mo nawalan ka ng immunity, not because nag-donate ka ng plasma, but because your body was desensitized to the antibodies. Just like for your flu, you develop immunity for the flu, but you keep on doing booster shots every year because you don't want to lose that yung potency ng antibodies ng katawan.
Doctor, next question from Miss Rain Sulaiman. Miss Rain. So her question, Doc, is okay.
Hello po, Doc. Question lang po regarding sa pag-donate niyo po ng convalescent plasma. Is it the same lang po ba na pagka nagdo-donate ka ng regular blood donation po? Ano po yung mga sinabi or in-advise sa inyo before undergoing convalescent plasma or yung preparations niyo po before you undergo po?
Number one is, ang question is, kailangan nagka-COVID ka. Although, kung let's say you don't have COVID at this point, it's also important for you to donate blood, not just the plasma. You could do whole blood kahit hindi convalescent plasma. So ang first criteria nila is nagka-COVID ka and you recovered from COVID. And then secondary na yung mga other question like, are you taking medications? Just like with yung usual na blood donation, they will ask you if meron ka bang diabetes, meron ka bang mga health conditions, if you have hypertension. So i-check nila yon lahat-lahat, and then they will advise you kung sino man ang magkukuha ng blood. They will advise you kung ano yung protocol nila. Usually, if merong medication na bawal, they will tell you na, don't take this medication for how many weeks, and then balik ka sa amin, tsaka ka namin kuhanan ng blood. But let's say high blood pressure ka, mataas yung BP mo, you could still donate blood, but it should be controlled blood pressure. Controlled blood pressure, and then for diabetes, it should also be controlled. So they hindi ka nila i-discourage magkuha. And then before you go to the donation center, meron kang i-fill out na questions. They will check everything, your hematocrit, your hemoglobin, your cholesterol level, your iron, lahat yon i-check nila. And then ang pinaka-importante dito is like pagpunta mo doon, make sure before going there to drink plenty of water. Kailangan i-overdose mo talaga yung sarili mo ng water because kukuha sila ng blood. That's why possibly magkaroon ka ng hypovolemia. That's why you need the fluids.
Thank you po.
Okay,
You're
thank you,
welcome.
Dr. Ong. Next question is from Ma'am Evangeline Orata, our faculty. Ma'am Orata.
Hi, Ma'am Orata.
Hello po, magandang umaga dito. Sir, what are the potential adverse effects of convalescent plasma therapy?
Potential effects is similar to, like I said earlier, like for the blood transfusion. Adverse effect, right? So number one is embolism. Number one is allergy reaction, like yung mga Rh positive or may times na nagkakaroon ng sensitivity issue, hypersensitivity, kaya nagkakaroon ng allergic reaction. And connected to this allergic reaction is the airway and also the breathing. That's why I told kanina na just remember yung ABC. A is allergy. B is the breathing. Because of the embolism, it could go to the lungs and shut down yung respiratory system. That's why you need to watch out talaga while during infusion. And lastly would be the usual complication. Ang problem ngayon is like the long-term effect of the convalescent plasma. Take note, yung short-term effect mabilis yun. Pero yung long-term effect, it's really hard to trace simply because yung sa video na pinakita ko sa inyo, it's just like started in April. But in some countries, nag-start sila earlier than April. But still, we don't have enough data to support kung ano man ang findings na meron tayo. But so far, they're still using it. That means to say that very minimal yung long-term adverse effect.
Thank you.
Thank you, Doctor. Maybe we don't have any question from our graduating student, Dr. Dino.
Okay, so thank you very much, Ma'am Sharon, for facilitating the Q&A. So this is very much useful, especially in the upcoming board examinations, because it is expected that our Board of Nursing will ask questions related to convalescent plasma. And at this point, as we wrap up, we would like to thank Associate Professor Dr. Ong for your time and of course your expertise that you shared to us and to our students. We know that it's 12 midnight there in the US and still you are always saying yes in giving back to our students and giving them an idea on how they can, of course, progress their career and how they can, what's the status of the hospitals out there, because our students are inside their homes and they are taking virtual classes. So they don't have related learning experiences. And I think this is a very good opportunity for our students to know more about our alumni who are working in the front line. Okay, so before we end our session, so let us have a class picture, if that would be okay. So we will be having recorded video. So you're going to turn on your
Hindi po mabuksan, sir.
okay, so sige, kung hindi mabuksan, okay lang. Pero at this point, so just some sort of souvenir for Dr. Ong. We're going to have a class picture. Okay, so you're going to wave. You're going to wave for 5 seconds. Okay, kasi video siya, or 10 seconds na lang. Okay. Sige, our timer starts now. Okay, so we're done. So this session will be posted at my YouTube page for your future reference. And please don't forget what Dr. Ong mentioned, something about your course task. So you can complete the course task within 2 weeks. Okay, after accomplishing the exam and downloading your certificate for that course task, you need to upload it in your Canvas course task. And that will automatically give you a point of 100 points for your first course task. Okay, so with that, again, Dr. Ong, thank you very much. And guys, don't forget our next session, our frontliner session this coming Friday. So if now we have our alumni from the United States of America, this coming Friday, we will have another excellent alumni coming from and working from New Zealand. Okay? So with that, thank you very much. And our session will end after
Stay safe, everyone.
Okay.
Thank you po, Doc.
Okay,
Thank
our
you,
session
Doctor.
will end
Stay
after
safe.
the achiever video.
Thank you
Thank you po,
po.
Doc.
Thank you, thank you.
Thank
Thank you po, Doc.
Thank you,
Thank you.
Dr.
Hey,
Ong.
stay
Thank you
safe.
po.
Salamat po.
Oh.